Hello, my name is Aaron and I'm the market researcher for our new drug, Restable. My group members include Alana, our biologist, Joanna, our pharmacologist, Arthur, our development head, and Alex. In the current market, there are two types of psychotic drugs used to combat schizophrenia. The first type are old conventional drugs known as tranquilizers. These include chlorpromazine and haloperidol, while the second and newer generation of drugs, which are antipsychotics, include risperidone, olanzapine, and quetiapine. The old drugs take 4 to 6 weeks to work. They are cheaper than the new drugs, but side effects include weight gain, higher glucose, higher cholesterol, tardive disease, drowsiness, constipation, nausea, sexual problems, lower blood pressure, and seizures. The newer drugs take only 3 weeks to work in comparison, but are more expensive. Side effects are the exact same as the old drugs, except with lower risks of tardive disease. But weight gain and high glucose still remain as huge problems. Both sets of drugs work by blocking the dopamine receptors, but the new ones are better at dampening our serotonin. Dopamine, for clarity, affects our emotions and sensations such as pain and pleasure. Serotonin affects our mood, social behavior, and sleep memory. New drugs are better at not showcasing a person's illness, but the overall effectiveness can be broken down like this. There is a good response in 40 to 50% of patients, a partial response in 30 to 40%, and absolutely no response in 20%. For that 20%, there is very little hope. Most of them usually end up homeless or in mental institutions, and this is who we're going to try and help with Ristobal. And injections still remain as the primary method of delivering these drugs. Now to talk is Alana, our biologist.
The exact cause of schizophrenia is yet unknown. We believe that a combination of genes is responsible and not one single gene. The proof for that is in the general populace, 1 in 100 people will be diagnosed with schizophrenia. If a twin has been diagnosed, the other twin has a 1 in 2 chance if they're identical, and a 1 in 7 if they're fraternal. The child of a schizophrenic parent has a 1 in 10 chance, so there's a very clear link with genetics. Another common cause is a defect in neurotransmitters. This means that with the level of common neurotransmitters, dopamine and serotonin, have been changed, or the body's sensitivity to these neurotransmitters has been changed. There's also brain development. This could be a defect in the genes, as previously mentioned, or it can happen during pregnancy and birth. So conditions such as low birth weight, premature labor, and asphyxiation during birth is thought to have some effect on the development of schizophrenia. There are also triggers in susceptible people, so these don't necessarily cause schizophrenia, but if they're already susceptible, it can cause the development. So this is stress, especially life events, such as bereavement, divorce, or abuse, and also drug abuse, especially when it's psychosis-inducing, such as cocaine, cannabis, LSD, and amphetamines. As many causes and triggers exclusively affect the brain, so do many of the symptoms. The most common symptom, almost a hallmark symptom, is hallucination, where schizophrenic people will often hear voices, but they can also feel, smell, touch non-existent stimuli. Delusions may be the result of hallucinations as the schizophrenic person tries to explain the hallucination. Other changes in thoughts may mean difficulty concentrating and communicating because the thoughts become jumbled and disorganized. Alongside that, behavior may become unpredictable, inappropriate, or simply they may have the reduced ability to function normally, with apathy and anhedonia, which is the lack of pleasure from things previously enjoyed. Our expert pharmacologist.
The diagnosis of schizophrenia is not a life sentence of even worsening symptoms and recurring hospitalizations. With the right treatment and self-help, many people with schizophrenia are able to regain normal functioning and even become symptom-free. So how it works? So like in medication, medication for this disease work by reducing physiotech symptoms such as hallucinations, delusion, paranoia, and disordered thinking. But it is not a cure for this disease and is much less helpful for treating symptoms, and such as social withdrawal, lack of motivation, and lack of emotional expressive. So another way to work is therapy, and it helps you to improve coping and life skills, manage stress, address relationship issue, and improve communication. So group therapy can also connect you to others who are in a similar situation and can valuable insight into how they are overcome challenge. So these are the usual way of this disease actually works. So we get another one to talk about the development of it.
Before the drug can go onto the market, it first needs to go through 12 phases of testing. This is 1 preclinical testing and 3 phases of clinical testing. The preclinical testing can take a few months, and in this phase, it will be tested on animals to determine its toxicity. And then from there, the safe dosage for humans will be determined. In phase 1, it can take up to a couple of months, and it will be tested on healthy humans who do not have the disease. Phase 2 of clinical testing can take up to 2 years. In this phase, the drug will be given to a small amount of people who have the disease. It will be then determined if the efficacy and the safety of the drug is suitable for people who have the disease. Phase 3 of clinical testing can take up to 4 years. In this phase, the drug will be tested on a larger amount of people who have the disease. The efficacy and the safety will still be tested, but due to its length, rarer side effects will be unveiled. Once the 4 phases of testing has been completed, it will be made into reports and sent to the TGA. The TGA will then determine if the drug is effective enough and safe enough for consumption. If it is approved, production and sale of the drug can then be made. Up next is Alex from the marketing team.
I would like to introduce you our new product, Risperdal, the next generation of Risperdal, the well-known anti-schizophrenia drug. In current stage of development, we assume that new products will have less dangerous side effects. The major one is not causing young boys to develop large breasts, a condition known as gynecomastia. Due to this fact, we would like to make strong marketing campaign on teenagers that would be extremely profitable. From the numbers you know, the competitors have next to $30 billion in sales of Risperdal around the world. But with the new marketing campaign for teenagers, we can increase this figure by at least 20%. The testing shows that this drug has less interactions with other drugs, like blood pressure medication, so that would make it more popular for elder people as well. The development team also reporting that they found a way to improve the production cycle of the drug and made it around 15% cheaper to produce compared to Risperdal. To conclude, we have a new generation